My name is Heiner Wedemeyer, and I want briefly to discuss with you symptoms and consequences of an untreated hepatitis D virus infection. I'm a physician, I'm a clinician scientist working here at Hannover Medical School. And with my team, I have the privilege to treat many patients who are suffering from hepatitis D virus infection. As I will show you, this is really a severe infection if being untreated. And this requires some expertise and interactions among different disciplines. In Hanover, we have us located here. You can see here Hannover Medical School. You can see here that we are quite green city. We have a big city forest called Eilenriede. And close to this forest here, you see MH campus. What is really critical here is that we have all clinical disciplines at one site. So if there are clinical complications, we can take care of these complications. We also have diagnostics here, imaging, ultrasound, but also endoscopy, which will become important, in particular for Delta infected patients, as we'll show in 1 minute. But what we also have here, close interactions with translational research institutes to identify factors why some patients are really suffering from more severe disease while others take a rather benign course. And this is also the aim of our research projects here at Hannover Medical School and together with other colleagues in Europe and worldwide. So the hepatitis alphabet, A, B, C, D, E, I'm always claiming that D stands for devil because it's really inducing the most severe form of viral hepatitis. What does it mean? What does hepatitis mean? Hepatitis does mean that a healthy liver is no longer healthy, but yet that you see there some kind of inflammation. So there are immune cells invading the liver and they are damaging the liver. And with continued damaging of the liver, of inflammation, there's scarring of the liver. It's called fibrosis. The endpoint of advanced fibrosis is the development of a liver cirrhosis. And this is really a hard liver where the patients, and you can imagine that cirrhotic liver, that the liver function is impaired. And within this liver, there's another complication, and that is an increased risk for developing hepatocellular carcinoma, increased risk for developing liver cancer, which obviously we want to avoid by treating early. So what are these complications of an untreated liver in patients with liver cirrhosis? You can see here, if you have a patient with liver cirrhosis, you can see here these veins. You can see here that there's fluid in the abdomen, which we call ascites. This is water. And this is because we have portal hypertension. The blood does no longer flow directly and easily through a soft liver, but you have an increased pressure, and this means that water is released to the abdominal cavity, so we have water in the abdomen. The other complication is that if the liver is no longer functioning in the right way, the liver is clearing the blood from bad substances. This is what we call in medicine detoxification. So toxins are taken out of the blood. And if these toxins are no longer cleared by the liver, then the brain is not functioning properly. And that is called in medicine hepatic encephalopathy. And that is really one major complication. Another complication is if the blood does not flow through the liver easily, the blood is looking for different paths to go to the heart. And then you have varices. We call this, and they occur in the stomach, in the bowel, but also in the lower esophagus, and that is called esophageal varices. And they are dangerous because they can bleed. If they rupture, then the patient is really at risk of dying from acute bleeding. The other complication is liver cancer. I will come back to this in a minute, but this is really increased in patients with any type of liver cirrhosis, but in particular in hepatitis D virus infection, this is really a major problem. Okay, these are complications which can occur in any kind of liver cirrhosis, different causes, alcohol, or if hepatitis C virus infection, or if there is SLD, steatotic liver disease, in advanced stages may also cause these complications. You are aware already that hepatitis D is a co-infection of hepatitis B. So B patients, in addition, may also carry the Delta virus. The question now that we have been addressing here is Delta really adding an additional risk to patients already being infected with hepatitis B? Or is it just something in parallel and doesn't really matter that B is dominant and Delta doesn't really cause additional threats? And Annika Franke from our team in Hannover has analyzed our data very recently, and these data are exactly in line with publications from other countries, from Italy, from Spain, from England, from Turkey, and even from the United States, South America, and Asia. And the findings here, as one example shown by the Hannover patient, is really that patients who suffer from hepatitis D virus infection have a much higher risk to decompensate. These are the complications I mentioned earlier, variceal bleeding or ascites. They have a higher risk to develop liver cirrhosis, but very importantly, and also hepatocellular carcinoma, and they have a much higher risk to die or to require liver transplantation. So Delta is really the devil, and you can see here that, let's say, after follow-up of 10 to 15 years, more than 60% of patients had developed clinical complications. It's really a severe disease, and therefore we really need to develop new treatments. We need to improve the outcome, but we need to understand why some patients develop complications, why others do not. What is important for diagnostics? In recent years, we all had to biopsy every single patient. So we take a tissue sample from the liver called biopsies, and then to analyze this, whether these scars are present, yes or no. We want to avoid this. This is complicated. It may cause some side effects. It may hurt. Are there non-invasive factors? And there are several ideas to look in the blood, but what is very important really to measure the stiffness of the liver. You can imagine if there are fibrosis is present, if there are other, if the scars are really severe, then the liver is no longer soft. Then you have cirrhosis, and this you can measure with liver elastography. And therefore, we think that every patient with HDV infection ideally should undergo these liver elastography to detect whether the liver is still soft, yes or no. The last point I think that is very important also for research is to understand why do some patients develop this severe course, including liver cirrhosis, but others do not. And we have learned over the recent years that one risk factor is being male. Men have a higher risk to develop clinical complications as compared to women. We also know that as the older you get, the higher the risk is that you develop clinical complications. You can imagine biology in patients with an advanced age is different than in young guys. So tissue repair is impaired. Therefore, the outcome in younger patients is usually better than in older patients. But there are a lot of other factors where the true importance for Delta is not really being has not been studied well and is not known, and that is the fact: are there genetic factors which are important, yes or no? We have some hints, but are not really sure. The environmental factors are not really characterized. We know that smoking is certainly not good for the liver. Alcohol, we know that it's not for the liver, but the context of Delta, we have only limited data. The last point I want to make is also when we talk about patients with HDV infection, this may differ worldwide because there are different subtypes of HDV. We have different genotypes. HDV strains which circulate in Africa are different from HDV viruses that we see in Europe, and these are different from Asian and American, South American samples. And we have some hints that the different genotypes lead to different outcomes in Delta patients. We are still working on this. We need research to understand, also for clinical practice, why some patients develop complications, why others do not. And this is important also for the development of new treatments. But what is quite clear, we need new treatments. We need joint efforts. We need to work together. And therefore, I think I thank you for listening here, and I thank all the people who are supporting this awareness campaign, the different consortia. I'm really thankful also to the European Union who invested money to research to better understand Delta. Delta is the devil, but I can promise you we are working on this to improve the outcome that maybe in 5 to 10 years, Delta is no longer the devil. Thank you very much.